Dka vs Hhns. Both are two complications of diabetes. Dka common with type 1 diabetes. Here three major pathophysiologic syndromes associated. Metabolic acidosis, osmotic diuresis, hyperkalemia. Due to the lack of insulin, cells are not receiving adequate fuel source to produce energy. This triggers the release of glucagon and other counterregulatory hormones and initiate gluconeogenesis to produce more glucose for the starving cells. Along with body begins to metabolize protein and fat to produce a source of energy. This produces ketones, which is an acid, causes a metabolic acidosis. Kussmaul respirations. Rapid, deep breathing at a consistent pace. Patient has fruity breath odor. It is the compensatory mechanism of the body to blow off CO2. Subsequently less carbonic acid is produced, thereby increasing the pH value and compensate acidity in blood. Patient will also begin to eliminate large amounts of ketones through excretion in the urine. When the blood glucose level goes high, significant amount of glucose spills over into the urine. A glucose molecule produces an osmotic effect by drawing water across a semi-permeable membrane. Glucose draws a large amount of water that ends up producing a significant amount of urine. This is known as osmotic diuresis and leads to volume depletion and dehydration in the patient. Hyperkalemia occurs due to extra hydrogen ions enters to cell and potassium come out. During emotional stress, illness, infection surgery, or trauma that requires an increased need for insulin. Assessment findings. Osmotic diuresis typically produces the classic signs and symptoms of hyperglycemia, polyuria polydipsia. Osmotic diuresis leads to dehydration. Dry and warm skin, poor skin, turgid, dry mucous membranes, tachycardia, hypotension. Other signs and symptoms. Nausea and vomiting, fatigue, weakness, lethargy, confusion. Management. Ensure an adequate airway, ventilation, oxygenation and circulation. The primary goal is rehydration with isotonic fluids. Initial choice is 0.9% sodium chloride. Then administer regular insulin for potassium if needed. Place the patient on a continuous cardiac monitor and obtain and record the blood glucose level. Next, hyperosmolar hyperglycemic non-ketotic syndrome. Commonly occur with type 2 diabetes. Due to insulin deficiency, body has severe hyperglycemia. It causes hyperosmolarity along with dehydration. Here patients still secrete small amounts of insulin, so no ketoacidosis may occur. Dehydration can occur if you do not drink liquid regularly, and this can become severe and lead to coma, seizures, and even death. Management. Same as DKA. Fluid replacement is the first priority in managing Hhns. The initial fluid of choice is 0.9% sodium chloride, NS. For insulin and treat electrolyte imbalance.